Good afternoon, everyone. It's John Horgan here on the traditional territory of Lekwungen-speaking people, the Esquimalt and Songhees First Nation. And I am joined by Health Minister Adrian Dix and Provincial Health Officer Dr. Bonnie Henry as we talk about the next 5 weeks as we work together to get to the May long weekend. This final stretch of the pandemic will be the most challenging of all of the many, many months that we've been working together to reduce the impact on vulnerable people, to keep people alive, to keep people safe. We have to make sure we do our level best over the next number of weeks to get to the end of the pandemic. Our vaccine rollout is accelerating and going very, very well. Minister Dix will be talking a little bit about that later on. I myself received my AstraZeneca vaccine a few days ago. I'm feeling fine, and I encourage all British Columbians to take the first vaccine offered to them. Dr. Henry will talk about changes in public health orders, or rules rather, about how those vaccines will be utilized. But it's a vital tool in our toolbox to make sure that we keep people safe and we get to the end of the line. I also want to take a few moments to talk about the limits on our public health care system. Again, Minister Dix and Dr. Henry will talk about impacts on our acute care system, but I want to talk a little bit about the impacts on the people that have been keeping our acute care system going for the past 14 months. Our nurses, our care aides, our doctors, who have not paused to party on the beach, but have focused all of their energies on keeping us all safe. And I lift my hands to them in an enormous amount of gratitude on behalf of all British Columbians for the extraordinary sacrifices they continue to make, putting themselves on the line to the verge of exhaustion, keeping their fellow British Columbians well during a global pandemic. An absolutely extraordinary effort by extraordinary people, and I thank them from the bottom of my heart. So how do we get through the next couple of weeks? We're in a serious situation. Minister Dix will talk about the numbers, but we require serious measures if we're going to get to May Day, to the the May long weekend, and salvage our summer. We want to have a safe and fun summer, but we will not do that if we lose sight of the objectives ahead of us. So when it comes to travel, Dr. Henry has been saying for months and months and months, stay in your territory, stay in your community. This is not the time to load up the Winnebago and travel around British Columbia. So in order to protect the loved ones that we hold so dear and to keep the strain off of our public health care system, we've been working with representatives from the tourism industry to reduce, in fact, to eliminate bookings from people outside of a particular area. If you live in the Fraser Health area, by all means, take a few days, get outside, perhaps go to a campground in your local area, but do not try and book somewhere outside of your area because the tourism operator in that community will not book you passage. This is a great step forward by the tourism industry. I want to thank them for working with government and with public health to make sure we can achieve this objective. If we can't do it without an order, we're prepared to bring an order in. But at this point, non-essential travel should be confined to local travel only. I'm confident that most British Columbians want to follow that order and will follow that order as we go forward. At the same time, we want to make sure that we are telling people that this is not just our best wishes or that you follow best efforts, but there will in fact be orders in place. So on Friday, Minister Mike Farnworth will issue orders under the Emergency Program Act to restrict people's ability to leave their health authority. This will be conducted through random audits, not unlike roadside stops for counterattack during the Christmas season. They will be susceptible to all travelers, not just a few travelers. And again, they will be random, and there will be a fine if you are traveling outside of your area without a legitimate reason. We will be consulting with the BIPOC community to make sure that we bring forward these restrictions in a way that does not give anyone fear that there will be additional repercussions. This is about travel. There will be no additional authority given to police. This will be a random audit to ensure people are following the guidelines. As I say, the vast majority of British Columbians are doing that right now. It's for that small group of people that are not listening, are not paying attention, and putting their fellow members of the community at risk. That's who we're focusing on. At the end of this week, BC Ferries will stop accepting bookings for recreational vehicles like campers and trailers. BC Ferries will also be contacting their passengers that have booked reservations to make sure that their travel is essential and is not leisure travel. We'll also, of course, be extending this throughout into the end of the long weekend. So traditionally at this time of year, BC Ferries will be bringing on more ferries to meet the demand. They'll not be doing that this year, and I want to thank BC Ferries for stepping up to make sure that we can use this piece of transportation to restrict travel into Vancouver Island and off of Vancouver Island. In addition, we'll be putting new border signs along the Alberta border, reminding our travelers coming from outside the province that unless they're coming for essential business, they should not be here. They should be back in their home communities. The added advantage, of course, is provinces like Ontario and soon to be Quebec, I suspect, are saying to their citizens, stay home. Dr. Henry, Minister Dix, and myself have been saying that since September. And I'm grateful that other provinces have come to the point of view where they're saying to their citizens, best to stay in your local community. We certainly endorse that. And by working with the tourism sector, we'll be saying to those who are trying to book accommodation from outside of BC, you won't be able to do so. These measures are designed not to put more stress on an already stressed tourism sector. Quite the contrary. We're working in collaboration with the tourism sector to make sure that they can have a positive summer and a fall and a winter that will try to make up some of the fallback that they've seen as a result of COVID-19. With respect to the circuit breaker restrictions that were brought in to battle the spring wave of the pandemic, this will be a surprise to no one. Those will be kept in place until after, again, the May long weekend, 5 weeks from now. I also expect that this is going to have an impact on people and businesses, and we understand that. And I want to make it abundantly clear that the circuit breaker programs that were put in place by government to help those businesses through will be extended as well. And so those businesses should not be fearful that their initial application is their only opportunity. They'll be able to make a second application to get through the second part of the circuit breaker. With respect to workplaces, Dr. Henry has been saying for some time that we need to make sure that when there are outbreaks in a business, that those businesses are not in a position to continue to spread the virus, and we'll be using WorkSafe inspectors to close those businesses if required, to contain outbreaks and to make sure that we're keeping people safe. All of these measures are designed with one purpose in mind, to get us all 4.9 million British Columbians to the end of the pandemic. This is done with a heavy heart, but it's done with a resolute purpose that together for this next 5 weeks, we can get to the end. Minister Dix is going to tell us that 30% of British Columbians that are going to be eligible for vaccinations have been vaccinated. And that's going to only continue in the days and weeks and months ahead as supply allows. We'll be able to do so much more once we get through the May long weekend, provided we follow the guidelines that have been put in place, now turned into orders, and we focus on the things that matter, making sure that our families are safe, making sure our communities can come out of COVID-19 stronger than ever before. And most importantly, I want people to think about those nurses and those care aides and those doctors and all of the people in our front line who have been giving up every single week, every single month for over a year to keep British Columbians safe. We cannot thank them enough, but we can say to them that for the next 5 weeks, we will be at their side, trying to reduce their burden by doing the right thing, following the orders, and keeping everyone safe. Thanks very much for your time today. I know there'll be some questions. Minister Dix has a presentation, followed by Dr. Henry, and then we'll get into questions.
Thank you very much, Premier, and thank you for Dr. Henry for moving us along here as well. I want to start just by reminding everyone of our goals in dealing with COVID-19, goals that have been in place now for a year in British Columbia. At the core of that is what the Premier just spoke about, suppressing transmission rates in our province, in particular, to protect at-risk populations until a vaccine is provided. Secondly, and this is what my presentation will be largely about, is avoid overwhelming our healthcare system and to provide quality care to non-COVID-19 and COVID-19 patients alike. and that's balanced against the ongoing physical and mental health needs of the non-COVID-19 patients and populations. Of course, having as much normal activity and a return to work as possible, and supporting the social fabric of families and communities. I think we'll move on to the next one. So 2 areas of concern right now are the growing pressure of hospitalizations for COVID-19 patients and the potential impact of that pressure on non-COVID patient care. This is a reality we're facing right now, and a reality we can face in the coming days and weeks. In addition to that, we need to balance that against the impact of additional measures on business and employee income and the impact of restrictions on ongoing individual and family mental health and general well-being. I wanted to talk about the status of hospital capacity, which would be the course of the presentation. I think we're back one. Last fall we laid this out. Last September we presented this. We had done previously in March of 2020. And we based our expectations for the fall and then into the spring on obviously hospital occupancy in previous years, in 2019 and 2018 in particular, including the effects of a typical influenza season where there are more respiratory admissions. The additional inpatient surgical demand as we put in place our surgery renewal commitment, and the extraordinary success led by our healthcare workers, our surgeons, and our nurses in our surgical renewal plan, and of course, possible COVID-19 demand. We laid out 4 scenarios. You can see them there. The presentation will be available online. But just to say, and you'll see at the bottom, that we're clearly at the high plus range of this right now in terms of the pressure on our healthcare system. So you look here in this chart about overall hospital occupancy, and what you see is that overall provincial occupancy rates remain under but close to bed-based capacity, which is unusual compared to pre-COVID years. In fact, it's lower in general than in pre-COVID years, the capacity of our healthcare system against what we would expect beforehand. Just to put it in context, in December of 2019, which does seem like a long time ago, it was generally leading into Christmas that year at 103.5%. However, we have to put it in real context. There are some significant regional and site variations in terms of occupancy rates. And we're going to talk about those specifically. So while this is the pattern across BC, the pandemic is keenly felt at important acute care hospitals across the province. And secondly, what the Premier has said, which is that we're 1 year into the pandemic. This has had profound effect on our health sciences professionals, our nurses, our healthcare workers, our doctors, everyone working in acute care and in the community. And we have to take that into account as we deal with growing hospitalization for COVID-19. And we are looking at a number of hospitals around BC and moving into the utilization of surge beds, requiring a degree of service deferral to support staff redeployment, to support our existing staff, and to deal with the pressures of COVID-19 admissions. On the next page, you see our overall occupancy. These are numbers that you'll be familiar with from our weekly briefings. What it shows is, of course, that there is significant capacity available in the system overall. But we're moving into the use of surge capacities, which will require some level of service deferral in some hospitals and in some regions to support staff redeployment. This means potentially deferral of surgeries, and you saw that that's happened in the last week, and as well other procedures. This chart tells you, this is similar to what Dr. Henry presented on Thursday, what we've seen in terms of COVID-19 hospitalizations and comparative peaks. You'll recall that at the beginning of April of 2020, we reached 149 people in hospital and 72 people in critical care. That's the first peak. We saw a significant rise to, I think at its height, around January 5th or 6th, to about 381 people in acute care hospital, and we see an even higher level of hospitalization now. These numbers are as of April the 15th. It should be said, and Dr. Henry will report on this shortly, that hospitalizations from COVID-19 have increased in the last few days. Overall hospitalizations declined, so these charts are basically tell us where we are right now. In other words, compared to January and compared to last April, the COVID-19 situation in our hospital is significantly more challenging. And so This describes it over the last month since March 17th, since St. Patrick's Day. We've seen medical bed occupancy gone from 220 to 298 patients, critical care occupancy from 83 to 127 patients. It'll be 137 today. And ventilated patients went from 37 to 65 patients. And so the capacity of our hospital, of course, and this is an important point, and the one at the bottom tells us why we've been able to sustain so well in our hospital system up to now, in part, first because of the extraordinary work and the outcomes in our hospital system and our acute care system, because of the work of our healthcare workers and our healthcare professionals has been exceptional. Our critical care outcomes are simply the best in the world. That said, one of the reasons we're able to been able to manage demand up to now is the virtually zero level of influenza this year. In April, 20 to 23% of inpatient cases and 10 to 12% of critical care cases would ordinarily be linked to respiratory illness. And this is obviously a key factor that's allowed us to sustain, up to now, COVID-19 occupancy. And so we want to focus. We've gone from the system-wide view, where there's some capacity but some challenges, to a view of the pandemic. And now we want to look at the subset of 20 hospitals who, through the pandemic, where we focus the majority of COVID-19 care. Those 20 hospitals have been put in place to optimize care and to provide rapid access to critical care when it is required. And they were developed in consultation with our clinicians. And they continue to be the focus of our COVID-19 efforts in acute care. And to understand where we are in terms of hospitalization now, it's important to look at those 20 hospitals, and that's what we're going to do now. And you see in those 20 hospitals, across health authorities in these charts, that the occupancy rate in our COVID-19 hospitals is higher than the provincial average, 94.9% of base beds. And further, that there is some utilization now of our surge occupancy, our surge beds that we've put in place in the pandemic that are available for use in our system. So our surge occupancy rate is 6.1%, and that is largely focused at a few hospitals. If you look at it in critical care, you'll see that again, our current occupancy capacity in critical care is 80.9% across the system, meaning that there are 84 vacant critical care beds. This was as of April the 16th. And that our, so this is within our base bed occupancy. What you can see is we've used, in this case, some surge beds already, and those surge beds have principally right now in Vancouver Coastal Health. We've had significant pressures, as people will know, on Lionsgate Hospital for some time, but we've seen them as well at Vancouver General Hospital. So in both of those cases, we are seeing the effects of pressures, and you can see across these 20 hospital sites a higher level of occupancy than in the system as a whole. The next slide deals with ventilator utilization, just to say that we have significant ventilator capacity, and we added to that significantly last year. So our utilization is at 29%, so we have a lot of capacity, but, and this is important to note, again, there's significant pressures in two ways. One, on staff. You have to have the staff to operate and have in place, and sometimes that will require reassignment. And some patients need different care than other patients. So even though we are only at 29% ventilator capacity, we have to carefully manage our systems of supports both for our staff and for patients in critical care. The next page talks about sub-regionally, where we're operating right now at 95% plus bed capacity. And these are the hospitals, and you see them on this list. And this is obviously particularly the case in the areas of highest COVID-19 transmission, which is in Vancouver Coastal Health, but in Fraser Health. But this also tells us why across BC we need measures across BC to address the challenges we're facing in terms of transmission. That there are indeed hospitals in Northern Health, at Mills, in Fort St. John, and as well in other parts of the province there are significant challenges as well. I'd also note that there are a number of hospitals, and I'd cite in particular Lionsgate, Royal Columbian Hospital. Lionsgate is here in critical care, but Royal Columbian Hospital that are just below 95% right now. And there are a number of hospitals in those circumstances. So while these hospitals are in the most significant circumstances, there are a number of other hospitals that are close to above 95% of base bed capacity. So who's in hospital? And I think Dr. Henry made this presentation, so I won't dwell on this at all on Thursday, except to say this. We're seeing more hospitalized cases amongst those 20 to 29. That's gone from roughly 3.7% of cases to 5% of cases. And the largest part of that increase is among women, and you'll see that in the chart. But the most notable increases are among people in their 50s, 50 to 59-year-old men, and 55 to 59-year-old women. We've seen, as you can see, over the period, if you compare December to March, a steady decline in those over 70. But the next page shows that as you go month to month, you'll see that there has been an increase in hospitalizations, even in older categories, from where we were a month ago. And that has been the trend. That, as Dr. Henry has repeatedly said, hospitalizations are a lag indicator, and the increase in cases a number of weeks ago has led to an increase in hospitalizations. And that is obviously a concern. So finally, what are our operational management activities and protocols to deal with this? Last March, as you know, faced with what we saw in Italy and Wuhan, and not knowing what we were to expect in British Columbia, we took very decisive action system-wide to cancel all non-urgent scheduled surgeries, sometimes called elective surgeries. That is not what we're doing now. But we do have a plan in place that's been in place in September, and that plan has been put in motion in the last over that period since September, but in particular day-to-day and multiple times a day to deal with changes in hospitalization across the province. So that daily monitoring and reporting, those daily meetings that occur to make sure that we're addressing issues in every community and in every hospital are taking place now. Our surge activation management is under daily consideration, and that means potentially leveling the load across sites and regions. In other words, moving some people with less serious conditions from one hospital to another to level out space in hospitals. That's been in place. But also, where required, the managed reduction of services, scheduled services in particular hospitals. You saw that a week ago at Abbotsford Regional Hospital and Surrey Memorial Hospital, in Vancouver General Hospital, and in Royal Columbian Hospital, and those decisions based on our plans will be assessed and dealt with on a daily basis. Also, the ventilator management I spoke about, and all of our work in our rural, remote First Nations and Indigenous communities transportation response framework to move people to the care they need when that is required. So reducing hospitalizations, how does that happen? I'm going to turn this over shortly to Dr. Henry to talk about some of this, but that our current vaccination strategy will further and gradually impact hospitalization in the coming weeks for the 60-plus community-based population. You're seeing that as we move down the age cohorts in terms of our main age-based vaccination campaign, and also the focus on those in the last number of weeks over 55 with our AstraZeneca campaign, and now Dr. Henry will be talking about the future of that in her presentation. We need to take action together. What's happening in hospitals is always affected by what all of us do in communities, and we all have to take action to reduce transmission of COVID-19, which has as an effect the number of people seriously ill in our hospital system. And of course, we're hopeful that the end of respiratory virus season may further impact transmission. And with that, it's my honor to introduce Dr. Bonningham.
Thank you very much. I'm going to start by quickly running through the statistics from our weekend. From Friday to Saturday, we had 1,027 new cases diagnosed in British Columbia. Saturday to Sunday, an additional 933 cases, and in the last 24 hours, 1,000 new people diagnosed with COVID-19 in British Columbia, bringing our total for the weekend to 2,960 new cases, and our overall total to 120,040 people in British Columbia with COVID-19. Of the new cases, 696 were people who lived in the Vancouver Coastal Health Region, 1,845 are people who live in the Fraser Health Region, 108 people live in the Vancouver Island Health Region, 211 people in the Interior Health Region, and 100 people in Northern Health. Currently, we have 9,353 active cases across the province, of whom 441 are currently in hospital, 138 people in critical care or ICU. We now have 14,711 people under active public health monitoring and 108,919 who have recovered from COVID-19. We have no new outbreaks to report over the weekend, and the outbreaks at the Vernon Jubilee Hospital and the Seagull Family Health Centre in Vancouver have now been declared over. So that leaves us with 5 active outbreaks in long-term care and assisted living and 5 in acute care units. Sadly, this weekend, we've had 8 additional deaths reported across the province, bringing the total number of people who've died from COVID-19 to 1,538. I'm also very saddened to report that in recent days, we had a child with COVID who was under the age of 2, who has died as a result of complications from COVID-19. Although this child had pre-existing health conditions that complicated their illness, it was the virus that caused their death. This young child resided in the Fraser Health Region, but were getting specialized care at the BC Children's Hospital. And although many are probably aware, this tragically is the youngest person in our province who has died from COVID-19. And it reminds us of the vicious nature of this virus. And our thoughts and prayers and condolences go to the family of this child and to all of the families and care providers who I know have been so affected by caring for people and who have lost loved ones in this pandemic. I'm going to turn now to finishing off the information that we're being provided on what is happening with our context right now. I will say, to start with, to date, we've given 1,380,160 doses of all 3 COVID-19 vaccines in British Columbia, and that remains an important part of our strategy to get us through for the next few months. Vaccination has proven to be one of the most powerful tools that we have, and we've seen around the world and in BC how immunization can get case rates to our post-pandemic levels, and this is what we need to focus on over the next 5 weeks. We are on track for dose 1 being available to all residents in British Columbia by the end of June, by July 1st. As of April 14th, we had about 27% of our adult population that has received at least 1 dose, and by today, that's up to 30%. So we are on our way, but we are not there yet. The balance of a little over 3 million people who are eligible to be vaccinated. We expect our supply of doses to the end of May, about 1.5, almost 1.5 million doses. And these are the ones that we have been guaranteed so far, will mean that about 60% of our adult population will have access to dose 1 by the end of May. We know that there can be challenges with arrival of some of the vaccines, particularly the Moderna vaccine, and that has been one of the things we've had to deal with, particularly in the next 2 weeks. We have assurances, though, that from our federal government, who is working hard to make up these shortfalls, that we'll have additional Pfizer vaccine coming online in the first week of May. The next 2 weeks is going to be important for all of us to get through this. We also have commitment, and we are confident that we will have the ability to get everybody their 2nd dose by September of this year. So based on the effectiveness that we have seen here in BC, but also around the world. And if we think about the countries that have been ahead of us in this vaccine journey, we have been monitoring and working very closely with counterparts from the UK. I had another opportunity to meet with them this weekend, and from Israel. And what we have seen is that within 14 to 21 days, so 2 to 3 weeks after we reach a level of community immunization, we can expect an incremental impact, not only on transmission in our communities, but on hospitalization. So what we expect to see is that by the end of April, we are going to start seeing more of a decrease in transmission and hospitalization for those most at risk, people over age 65. And we have seen that as well with some of the data I've presented from here in British Columbia, looking at our long-term care homes, our healthcare workers, and following cases over time. We've seen a dramatic drop-off after about 3 weeks that remains sustained and low. And we've also seen it in some of the communities where we've done community immunization, and particularly in Prince Rupert, where we've seen cases drop off dramatically in the 2 to 3 week range. So as we see over time, it takes some weeks for the immunization program to catch up with each age group. We're now close to 90% of people over age 90 who are protected with immunization, and that is increasing in ages 85 to 89 and 80 to 84. And we know that as well, that our program for clinically extremely vulnerable is well underway. Over 210,000 letters have gone out, and to date, 60% of people have completed, have been booked and immunized in that group as well. So this tells us that our immunization program is working. It's reaching those who are most at risk. 100% of our long-term care and assisted living sites have been offered vaccine, and we've had very high uptake there. And we've completed immunization across our higher risk work sites that we've talked about, particularly across the Lower Mainland, where we know we were having ongoing challenges where workers cannot work from home, and the difficulty in maintaining COVID safety plans is really challenging, particularly in food processing, our farms with group accommodations, and distribution centers, manufacturing and industry, and that continues as well. The Pfizer, BioNTech, and Moderna vaccines are the basis that we use in our age-based programs and those age-based clinics. Those are the vaccines that are available, and it has been, it continues, and we're ahead of schedule. Generally, right now, we're booking appointments for people aged 63 and above across the province, and the next 2 to 3 weeks we'll be focusing on vaccinating everybody in the over age 65 age group. As well, we've had over 1 million people have registered in our system, and registering is the easiest and simplest and most efficient way to be notified as soon as your age category comes up. And we have been immunizing 240 to 260,000 people per week across this province, using up all the vaccine that we have as it arrives. And that will continue. And that's the main focus of our program as we get through this next few months. The other vaccines that we've had here in British Columbia, we've had some challenges. As you know, we paused the use of the AstraZeneca vaccine that we have in certain age groups until we had a better understanding of what was going on with the safety signal that we detected from Europe. And as of April 14th, over 114,000 doses were administered across British Columbia to people primarily over the age of 55, although we initially had a good start with some of our worker program. And we have about 88,000 doses of this vaccine in 600 pharmacies across British Columbia, and they will continue to provide it. In addition, we have now access to an additional 75,000 doses of AstraZeneca from the United States. That's providing us with another opportunity to advance our vaccination schedule. Over this past week, we have been working very closely with Health Canada, with our National Advisory Committee on Immunization, and with my counterparts from across the country to better understand the risks and the benefits of this vaccine in the context of the safety signal that we've heard. And it's now become clear that the risk of very rare blood clots associated with vaccination is in the range of about 4 in a million. And we need to put that in the context of what we are seeing across our province right now, where COVID transmission rates are very high and high in many communities. And the risk of hospitalization from COVID is about 2 to 4 in 100 for most people. So we know that the benefits of this vaccine are far outweigh the risk of very rare blood clots. We also know that we understand a bit more about how these happen, and clinicians have been notified. We have a test for it, and we have treatment. So we now need to target our use of this vaccine to support people being protected soon and now from COVID-19. So based on the risk of hospitalization that we've seen, particularly in younger age groups, we're now going to expand the use of the AstraZeneca to people 40 and above across the province. So it will be available in pharmacies for people age 40 and above in all the pharmacies across the province. In addition, we're starting a targeted AstraZeneca-only clinics for people 40 and above in specific high-risk communities. So these highest priority communities have been identified by the data that we've been collecting at the BC CDC that allows us to understand where the highest transmission risk is happening and where the immunization rates are lower. So based on this, we are targeting a number of communities where we know the case counts are high and where we need to have some targeted input to protect people that are ending up in hospital right now. The majority of these communities, not surprisingly, are in the Fraser Health Authority, particularly in and around Surrey, where we've had ongoing transmission in communities across that area from the beginning of the pandemic, really. We also have recognized that transmission in Dawson Creek is a challenge, and the other two areas outside of Fraser Health are the Squamish and Kensington areas and Vancouver Coastal Health. So starting today, these communities will have AstraZeneca-based clinics that will target people aged 40 and above to get vaccine now as we continue with the older populations in our age-based program. Looking ahead to May and June, we're going to continue these several streams. Our main focus on our age and risk-based approach, getting as much vaccine as we can out to clinics as fast as possible, as supply allows us. And we're hoping that as we get into the first weeks of May, the federal government will come through with it. They've promised, and I know they're working very hard on that to get us more Pfizer vaccine. We will continue vaccinating frontline workers with our early focus on first responders, school-based staff, and childcare staff, starting with those communities where the risk is highest and moving through all of our first responders, school-based, and childcare staff in the coming weeks. We will continue to use vaccine as part of our outbreak response, and that's important. It's not only closing businesses that stops COVID-19, it's also making sure that we have immunization as available to support that. And we will continue to target communities where higher transmission is impacting our hospital system. We have started to see the impact of our public health measures. We are bending our curve slowly, and we see that here. The green line on the top is the number of daily cases that we've seen over the last months. Our hospitalization continues to go up, and that is what we need to address now through immunization and through ongoing public health measures. Thankfully, our rates of death have remained low in the last few months. So, as the Premier mentioned, as of today, all of our current guidelines and public health orders will remain in place and will be extended for the 5-week periods to the end of the May long weekend. It is critical that we focus our efforts on continuing to do the things that we know reduce transmission, including and particularly our focus on our impersonal social interactions, being purposeful about who we are with, and making sure that we're not bringing this virus home to our family, to our workplace, to our communities. As the Premier mentioned, we have been working with across the province to reduce the ability for people to travel from out of province into British Columbia, and to put in more measures to help people to stay within your region as much as possible and to follow our travel guidelines. We will continue to call on businesses to redouble their efforts around their COVID safety plans, and the orders that we put in last week that allow us to work with WorkSafe BC to support businesses when there is transmission in that business, to make sure that we stop those chains of transmission and allow people to safely reopen as quickly as possible. And we do this instead of broad closures along sectors of different parts of our business communities. We know that some people want to push those limits. And while we've seen most restaurants and pubs and gyms doing their best and doing the right thing. We know there have been challenges with some people pushing those limits around patios, around numbers of people. And when that happens, those businesses will be closed until they're able to adhere to an appropriate COVID safety plan. We all have this role in keeping ourselves, our loved ones, our communities safe. We now have extra tools to help us get along that journey. Particularly, we have immunization programs that are ramping up across this province to support us in getting to our post-pandemic world. We will have to live with COVID for a bit longer. We need to all put our efforts into combating this virus and supporting each other as we get through this next 5 weeks. Thank you very much, and I'll turn it back over to the Premier.
Thank you, Dr. Henry and Minister Dix, for those presentations. And I think it's abundantly clear to British Columbians that we are at the end of what has been the most extraordinary of years, but we are not through it yet. The orders announced today that will be taking effect throughout the week, and our commitment to each other is what's really important here. We all have to recognize we have a role to play. We are so grateful for our frontline workers, wherever they may be, in acute care, in the community, in our own neighborhoods. But we need to support those people by doing our part, by keeping distance from people that we don't know, by reducing our travel to only essential travel, and by focusing on the next 5 weeks so that we can save a summer that we all desperately need. The weather has been spectacular. I understand that's an incentive to get outside, and Dr. Henry would be the first to say, by all means, go outside. But do not go too far from your own backyard. Stay in your community, stay in your neighborhood, and think about all of those people who have been making extraordinary sacrifices, just like you, so that we can all come out of this better than ever before. And with that, we're certainly prepared to take some questions from the media.
As a reminder to reporters on the phone line, please press *1 to enter the queue. You're limited to 1 question and 1 follow-up. First question today is from Richard Zussman, Global News.
Premier, clearly there are a lot of questions about the logistics of exactly how this is going to work in terms of the travel restrictions. First off, people have been calling for this for a while. You said you were told you couldn't do this, and now you're doing this. How did that happen? And what sort of tools are going to be in place to stop people from traveling? Like, can someone from Vancouver go to Whistler even though it's in the same health authority? How will these police checks work in regards like that?
Well, certainly we never said we couldn't do it. We said that it would be logistically challenging, and it is and remains so. What we've hoped that the public would do, and the vast majority of British Columbians have, is to stay close to home. Be conscious of what you're doing. Be aware of your surroundings, the people you're engaging with, and what the consequences of that might be. Certainly, you cannot go to Whistler and stay if you can't book accommodation. So we're working on a voluntary basis with the sector to find ways to cancel bookings that have been made and to not accept any more bookings going forward through the May long weekend. In addition to that, of course, if required, Dr. Henry, Minister Farnworth are prepared to bring forward orders to make that impossible to do. But we're hopeful. Our approach from the beginning, as you know, has been to work with industry, to work with communities, and to work with people to find the best way to keep operating in a safe manner. Where that fails is where we have to step in. And as Dr. Henry said, in workplaces, we have now the tools through WorkSafe to make sure that we can go into those workplaces and take appropriate action as required. When it comes to travel outside of your health authority, we'll be using some hybrid on the counterattack programs that people will be very familiar with during the Christmas season to try and reduce those who would drink and drive. It's not unlike that today to have random audits, again, not providing any additional authority to law enforcement, but to work with law enforcement, and Minister Farnworth will have more to say on this later in the week, on how it is that we would manage that going forward. Our appeal to people is to do the right thing and to stay home. Do not plan a holiday until after the May long weekend. And that's the best way for us to go forward, is with voluntary actions by conscientious British Columbians who are focused on the well-being of their family, their community, and their province.
Richard, do you have a follow-up?
Dr. Henry, is there heightened concern around outdoor spread of the virus. Is that why we're seeing such a stark increase in restrictions now being put in place?
You know, we've been monitoring, of course, the spread of this virus. We know that some of the new variants are more transmissible, and we're seeing more of those, particularly in the Lower Mainland. So part of our whole attempts now to focus more on preventing people from moving about is because we've seen that it is the travel between regions that can spread this. And yes, we are concerned that even outside you can spread COVID-19, particularly the B.1.1.7. We've seen that in some areas. But overall, outside is still far lower risk than inside. So if you're outside, keeping your distance is important. We know from everything we've learned in the last year that walking by somebody or running by somebody is not going to transmit this virus. But yes, if you're sitting and dancing and singing in a group with people, we have seen transmission in those settings before, and we will see them again. So those things are pushing it too far. Keep in small groups, keep your distance, be outside, go outside with the small group of local kids, play frisbee, play soccer with your small group of friends outside. I've seen lots of people doing that in the right way this past weekend, having picnics outside, going for walks, going for runs, exercising, and just enjoying what we have outside. It is far, far safer than inside, but it's not 100%. And so be aware that even outside you need to be careful.
Next question is from Justine Hunter, Globe and Mail.
Hi, thank you. I'm wondering I know you said there'll be more detail later this week, but I'm trying to understand what authority police will be doing these audits, as you call them. You've seen the pushback in Ontario around the measures that they've imposed there, and the police are saying a lot of this is unenforceable. So how do you envision this is going to work?
Well, we are looking at other jurisdictions and how they've approached this, and we're trying, as we have been from the beginning, to chart our own course. Minister Farnworth will be using the Emergency Program Act to restrict people's ability to move from one health authority to another. Those orders will be finalized. They've been appealed by Dr. Henry, myself, and Minister Dix for months and months for people to follow that course of action, and now we're putting that into an order under the Emergency Program Act. But we have, Justine, you're quite right. We've looked at other jurisdictions, and we've taken guidance from those areas, and we do not want to lunge into these issues. We do it advisedly, and we do it in consultation with the tourism sector, for example, when it comes to bookings. We do that with BC Ferries when it comes to travel to Vancouver Island, off Vancouver Island, and to other coastal communities that are ferry dependent. We need to keep the ferries moving. We need to keep our roads going. We need essential services to continue. And it is not our objective to go into some sort of a state where we're watching and monitoring everybody's activity. We have done pretty well over the past year, but we have not done enough in the variant world that we now live in, with such a little distance between a place where we can get to 50 or 60% of our population vaccinated. We're so close, we can taste it. We need people to follow these rules to the end. The vast majority already are. I use the counterattack as an example. It is everyone who drives by. It's not what your license plate says. Everybody who goes by will be asked where they're going, where they came from. And I know at Christmas time when that happens, the vast majority of travelers are quite happy to pause and say, no, I didn't have a drink, and yes, I'm going home. This is the type of situation we're in. This is not heavy-handed in my mind. It's random, and it will be done in a way that includes everyone at a particular place at a particular time, and there will be consequences if you are outside of your area on non-essential business. Justine, do you have a follow-up?
Yeah, can you elaborate on what the consequences would be? Can you give us any idea? And also, there's just a significant amount of travel back and forth between, for example, Surrey and Vancouver every day. Those are two separate health authorities.
Again, Dr. Henry will be working with public safety to make sure that this is not overly complicated. Again, the Lower Mainland in most people's life is the Lower Mainland, Interior Health and Northern Health come together at Quesnel, but most people wouldn't know that if you drive 5 minutes south of Quesnel, you're in Interior Health, and you're 5 minutes north of Quesnel, you're in Northern Health. So we get that. We want to make sure that public safety representatives are not going to be heavy-handed with this. They have no intention. They don't want to do this. This is for those that are recklessly flaunting the rules. It's not for regular folks who are going about their business.
Next question is from Rob Shaw, Check News.
Just to pick up on those questions about details then. So if you live on the island and it's one health authority, you can travel anywhere on the island, or is that not what we're talking about here? Will there be checkpoints on near Tofino or audits or whatever we're calling these, or is that one health authority and you can travel within it without fines?
No, we're not putting up checkpoints. We're putting signage at the borders, reminding travelers from away that they should not be here. On the Island Health Authority, for example, again, we're asking people to use their common sense. We're asking them, and the vast majority, Rob, as you know, are doing just that. They're staying close to home. It's for those who are flaunting the rules, those who are deciding to get a holiday outside of their local area, that we're trying to discourage from doing that for the next 5 weeks. Minister Farnworth will be laying out the details as the orders come into effect at the end of the week. We wanted to have this discussion today so that people understood that we're not going to follow other provincial leads and bring forward proposals that can't be enforced, or quite frankly that reduce confidence in our objective here, which is to collectively say let's redouble our efforts, let's bear down for the next 5 weeks so that we can have the summer that all of us desperately want.
Rob, do you have a follow-up?
Sure. Can I just switch to AstraZeneca? So the National Advisory Committee hasn't, and Dr. Henry, correct me if I'm wrong here, hasn't recommended the age as 40 and up, but the federal government and Health Canada did that on the weekend. And so we're not waiting for the National Advisory Committee. We're satisfied with Health Canada saying that, or maybe you could just sort of clarify what has changed that would allow us to go to the age of 40 and up.
So it's not even a cutoff at age 40, so let's be clear about that. We have been following in BC and across the country, looking at what the evidence has shown from the EMA, from the UK, from the US, of course, with the Johnson & Johnson. So as we've learned about this safety signal and we've learned about the risk of this rare event, we've been looking at the risk-benefit here in British Columbia. So Health Canada is the regulator. The regulator looks at safety and effectiveness, and then the National Advisory Committee on Immunization provides guidance and advice on where to best use these vaccines. And yes, we are, NACI will be coming out with their recommendations very soon about how to approach this, but we felt we needed to move ahead in using this important vaccine to support our programs given the situation we're in here in BC. So we did our risk-benefit analysis here in British Columbia, looking at who was ending up in hospital. A couple of things that were really important that we've worked with Health Canada and with our colleagues across the country, and why we've come up with very similar recommendations for use in Alberta and across the prairies and Ontario, and I know Quebec. We've all been talking together about how to do this in a way that is coordinated and recognizes our different epidemiologic situations as well. So some of the things that we've learned over the last little while are that we learned from the UK that single dose vaccine effectiveness at preventing both transmission, but more importantly, hospitalizations and severe illness is as good with AstraZeneca as it is with a single dose of Pfizer, and that's in the high 80s. That's real-world experience that's come out of some of the the evaluations they've done in the UK. So that's important. That tells us that a single dose of AstraZeneca is going to keep people out of hospital. So for us in British Columbia, recognizing, as I presented last week, the increase that we're seeing in hospitalization is people from 40 to 59 and 69. So we want to be able to target specifically the AstraZeneca that we have on people 40 and above right now to try and address that hospitalization risk. And right now, we also need people to think about the risk benefits of this vaccine, given the case rates that we're seeing and the impact on hospitalizations and on severe illness and things like the long COVID that some people are experiencing, even with milder illness. So I'm confident that the benefits of this vaccine far outweigh the very rare risk of these blood clots. And we're going to be targeting our program in BC to people age 40 right now to try and prevent hospitalizations in the next few weeks.
Marcella Bernardo, News 1130.
Hi, I'm not sure who wants to answer this, but the elephant in the room today for me was that a child under the age of 2 has died now from COVID-19. And we did not have that transparently given to us right away today. We had to wait till halfway through this news conference to be told that a child has died for the first time from this disease in British Columbia. Can somebody please expand on what are the ages of the other 7 people that died, or what information can you give us about this particular child that has died from COVID-19, and it's the first person in that age group to die?
Yeah, as you know, Marcelo, we talk about the deaths every day. We report them in the weekly surveillance summaries. And yes, we understood, we were provided with the information that one of the deaths that was reported today is in a child. And it is a tragedy, absolutely. And it's one of those things that we were hoping we would be able to avoid. We've given the ages of people who have died. I don't have all the rest of them today, but most of the other people who died this weekend are people in their 60s and above. So it is an unusual event. It is a true tragedy, and it's a reflection of the impact that this virus is having across our communities. This was unfortunately a child who was not in care. They had a number of health issues. They received the best possible care they could at Children's Hospital, and unfortunately COVID took their lives.
Follow-up, Marcella?
If Premier Horgan could answer this, you have talked extensively about what people should do and what people should be doing, and it's very frustrating for many of us to watch when people are violating these orders and restrictions and they're not being punished for it. Not a single ticket was handed out to anyone on the beach in Vancouver over the weekend when it was clear that these people were violating orders. So how does that, travel restrictions, how is that going to keep people from breaking the rules on beaches when it's evident that police are taking a hands-off approach and others who are responsible for enforcing these rules are doing nothing?
Well, certainly we're working through public safety and with the Ministry of Municipal Affairs. Josie Osborne will be talking to mayors and councils, as she has been weekly since November, and Minister Farnworth will be talking to mayors who have responsibility for police boards in their community with respect to, and as we go forward, and this is part and parcel of an answer back to Rob's earlier question about how we're going to manage the intermunicipal travel within health authorities, and that'll be through consultation and dialogue with the representative authorities in those communities. With respect to the events over the weekend, you can well imagine how I feel about it, and I share the views of the overwhelming majority of British Columbians that it is profoundly disappointing to see behavior of that kind at a time when we are so close to getting out of what has been the worst year of our lives. To hear of the death of a 2-year-old today is a graphic reminder of how we are all susceptible to the ravages of COVID-19. You are not immune just because you're 19 years old and feel invincible. And the challenges of law enforcement are that I certainly do not direct law enforcement on how they are supposed to operate within their communities. There are other levels of authority for that. I do know Chief Constable Adam Palmer is is going to do everything he can to make sure that within the City of Vancouver, investigations are conducted of activities that took place over the weekend. Investigations, as you know, Marcella, from your many, many years in the business, do not end at the moment of the event. They go on through looking at tape, talking to witnesses, and then proceeding with charges. So I don't believe we're done on the weekend yet, but again, those are choices for law enforcement to operate. Our job is to put in place the framework for them to operate. They have to make decisions on the best utilization of members when you've got large crowds in one part of town, and as I understand it, a shooting just down the street that would have required attention by those on staff as well. It's not a perfect situation. No one suggested it would be. Am I frustrated? Understatement of the year, I would suspect.
This question is from Shannon Patterson, CTV.
Oh, hi, Dr. Henry. Just a little bit of confusion about the AstraZeneca. So is it the 88,000 doses that are still in pharmacy freezers that are now available to any British Columbian over the age of 40? And these 75,000 doses that are separately going to be put into clinics? And what happens to future AstraZeneca doses? Is this 88,000 in pharmacies it? And after that, it's all going to clinics?
So the answer to the first question is yes. So we have about 88,000 doses that are still out in pharmacies, and yes, it will now be available to anybody from those pharmacies age 40 and above. And we are doing targeted AstraZeneca clinics in those high-risk communities that I mentioned. So those will be health authority-run clinics in those communities. We don't yet have line of sight on additional doses of AstraZeneca. So as the program evolves over the next couple of weeks, as we get more doses in, hopefully, right now we don't have any. We don't know yet whether they will be coming and when. So that will be targeted to both the pharmacy programs and depending on how the clinics are going and which communities we need to target next.
Do you have a follow-up, Shannon?
Yeah, I have a question from a colleague of mine. During the technical briefing, you talked a little bit about the stress and the exhaustion on frontline COVID wards. Can you talk a little bit about that and how that impacts the ability to deal with this increase in hospitalizations?
Yeah, and you know, I had the privilege of meeting with some of my colleagues and friends, and I talked to a lot of people who are working in our frontline hospitals around the province, as well as in public health around the province. And, you know, contact tracing is exhausting, but it's the people who are working on the front lines in the hospital, who are seeing people come into the emergency department, families come into the emergency department, being admitted to the ward, being admitted to ICU, and then hearing things that are happening out there in the community about people not paying attention to this, not taking it seriously. And they get very discouraged when you've been doing this day in and day out for a year and a half. It wears people down. And people are, you know, we've got a really great team. Our critical care teams across the province are working together in a way that is supportive and amazing, but they're tired. They're tired of seeing young people coming in, and there's been a narrative out there in the last few weeks of that we're overreacting, that nobody's paying attention to this, and that is hard for people who are going to work every single day and are looking after their families, who are doing those overtime shifts and getting more and more concerned that there are people coming in and they won't be able to care for them appropriately. So it is a wake-up call to all of us that we need to do our bit as well. And that means staying home. It means making those sacrifices, small and big, every day for the next little while as we're protecting more and more people with immunization. And I've talked about this for some time, that we're in this vaccine hope, but pandemic reality, and the pandemic reality has gotten challenging and more dire in some ways in the last few weeks. But we have the ability to level things off, and we've started to see that. So that is what we need to focus on. We have vaccines that work, and they are going to get out to everybody as soon as we possibly can. But it's hard for people right now. It's hard for people when they see others flaunting things and not taking it seriously.
Vincent Plena, Daily Hive.
Hi there. Premier Horgan, regarding these checkpoints and bookings, will people have to provide proof that their travel is essential if they're at these checkpoints, or in fact they do need to make a booking?
Well, certainly, again, I want to avoid the term checkpoints. These would be random audits. We're not putting up booths at the borders of going from Chilliwack into Hope. We're going to be randomly checking, as we would during a counterattack program, all vehicles for a period of time on a piece of highway somewhere in British Columbia. Again, the details of that will be worked out by public safety, and the requirements to demonstrate you're going in the right direction at the right time will be made clear when Minister Farnworth brings forward the order. In terms of the bookings, I want to just lift my hands with gratitude to the tourism sector, which has been just decimated. Without any question, the most hard-hit sector in British Columbia as a result of COVID. And despite that, at this late date for them, as they were hoping for bookings in the summer and then a strong fall and winter, to have us sit down with them and say, how can we try to prevent the number of people coming from outside of a community into a community? And they said, well, we can work on that. Let's do it together. If they need the order, then we're more than prepared to do that. They believe they can manage this on a voluntary basis to start, and then we'll see where we go from there. But this is, I think, a classic example of us asking questions of communities and of stakeholders of how they want to proceed. And as Dr. Henry says, the overwhelming majority of British Columbians get this. They get that we all have a part to play. We have some who are giving greater sacrifices than others, without any question. The saying that's now become commonplace, that we're all in the same pandemic, but we're in different boats, could not be clearer than right now. Frontline workers are struggling way more and sacrificing way more than the rest of us. Some businesses who have been able to continue to operate throughout the pandemic are doing quite well. Others that have been curtailed because of the type of work they do or the service that they provide are struggling and looking for hope going forward. And I want to reinforce that the programs that we put in place to address the circuit breaker that Dr. Henry brought forward 3 weeks ago will remain and will be extended through this next period as we get to the May long weekend. Our commitment to the people, the businesses and the communities of British Columbia remains the same. Our commitment to each other needs to be fortified at this point in time, and I'm hopeful that the comments that we were able to make today will bring that home for more people who have perhaps been paying less attention to this point in time than they should have.
Do you have a follow-up, Vincent?
Yes, please. Dr. Henry, I wanted to build on Richard's earlier question. You've mentioned before that the COVID-19 virus becomes less transmissible during warmer weather. Is there any data or evidence that confirms or refutes if warm weather has the same effect on variants of concern?
Yeah, so let me qualify that. What I have said is that we see a decreasing in transmission of respiratory viruses in the spring and summer. We have a respiratory virus season in the Northern Hemisphere, and it tends to start in September and increase through December and January, usually is the peak, and then we see a falling off come March, April. And we see that with adenovirus and enteroviruses and respiratory syncytial virus and influenza, and we've seen that as well with COVID, but it doesn't go away necessarily. We saw that last spring when we started to see part of it is weather. We don't know all of the factors that lead to decreased respiratory transmissibility and the sort of disappearance of many respiratory viruses in the summer season. They become more sporadic. It doesn't mean they go away entirely, and they didn't go away entirely last summer. And yes, we don't yet know if that natural waning will be overshadowed by the increased transmissibility that we're seeing from the B117 and P1 in particular. So those are things that we still have to watch for and see, but we do know that any virus is less transmittable outside than inside. We know the highest risk settings that we've seen, and right now we've been seeing transmission in those settings things indoors, when there's more crowded people, where you're talking loudly, where there's poor ventilation. So we have to pay attention to all of those things, and that's why I'm saying, now is the time to go outdoors, to keep small, and we'll see how things manage over the next little while.
We have time for one more question this afternoon. That comes from Tanya Fletcher, CBC.
Yeah, I'm not sure I heard how long these new travel measures are set to last. Are they indefinite? Are you going to more clearly define what essential travel is for people? And regarding law enforcement, how many police resources are they expected to dedicate to these road checks?
So I can talk to the first little bit. We are talking everything here about the end of the May long weekend. That's a period of time where we expect to have 60% of our adult population in BC protected with vaccine, and at a time when we hope that we can, the measures that we put in place will mean that transmission and hospitalizations have come down. We are working, we have a list of what essential is. We're working with public safety to define the areas that we're talking about around travel, and those will become clearer in the next few days.
Yeah, Tanya, I don't have much more to offer than what Dr. Henry just said there. But again, what I think we want people to take away from today's presentation is that there is hope in the vaccination program, and there is also concern in the hospitalization utilization. So we need to have the public understand that we need to make a few more sacrifices by reducing our travel, reducing the number of people that we engage with, and getting the first available vaccine when you're called upon to have that opportunity. Those 2 points today are what we wanted to leave people with. We have another 5 weeks to go to realize a 60% vaccination rate, and also to drive down hospitalization by making sure that we each do what we can to protect each other. In terms of the law enforcement components, Minister Farnworth will have more to say about that on Friday.
Do you have a follow-up, Tanya?
Please, and if we could get an answer in French from Minister Dix as well. I know you've been resistant to top details today, but these are the questions we're getting flooded with. So if private tourism operators are no longer taking and or canceling bookings from outside their health authority, will provincial parks also cancel bookings for camping from people outside the local health authority? And for those who paid a reservation fee before this restriction came into effect, will that reservation fee be refunded?
Yes and yes. Minister Heyman will be working through Parks BC to make sure that anyone who's booked a holiday outside of their health authority will be refunded any costs that were incurred either through the reservation process or the booking. And I'll let Adrian wrap it up.
Oui, la réponse est simple, c'est oui et oui, c'est-à-dire que le ministre de l'Environnement, George Heyman, va travailler avec les communautés et des opérateurs dans le secteur pour assurer avec BC Parks que des gens qui doivent aller en dehors de leur région de santé, que ce soit dans la région de Vancouver et pour des autres régions de santé pour leurs circonstances, et on va travailler ensemble pour répondre de cette façon. En général, je pense que le message est clair pour tout le monde, que cette période jusqu'aux vacances du mois de mai, du long week-end du mois de mai, il faut que tout le monde s'efforce à limiter leur mouvement dans la communauté, c'est-à-dire de rester près de chez eux, de travailler bien entendu, mais de rester près de chez eux pendant cette période. C'est ce qu'on peut faire nous tous pour aider ceux qui travaillent dans nos hôpitaux, ceux qui travaillent dans la communauté sur les questions de COVID-19, qui travaillent avec des gens qui souffrent des problèmes de la santé mentale. Il faut que tout le monde fasse ce travail maintenant à fond. Et donc, il faut que nous tous, qui nous travaillons dans ces domaines, leur aident en réduisant nos mouvements et nos transmissions de COVID-19. Merci beaucoup. Thank you very much.